Okay, so my second question is, a lot of people are asking about the quarantine protocol. What exactly happens once the moment the plane lands, and what happens to the Malaysians who are on the plane?
Right, you might want to know that even before taking off, there will be a kind of a pre-screening on the part of the Chinese authority and their health facilities to ensure that only the healthy get on board. And as soon as they are on board, our trained staff are in there to be observing. And as soon as they get to see any form of symptoms, they'll be isolated. They'll get down later. The healthy one get down first when on arrival. But more importantly, that in flight there will be this disinfection procedures that must be done, so they don't get disinfected as and when you see them going down the stairs. But they are done. All of this is done within the flight itself. So as and when they get down, they get straight into what is known as the air disaster unit, where they get to be screened. For those who are positive by way of symptoms, they'll get sent straight to the hospital, the 26 hospital that we have identified. And for those who are without symptom or asymptomatic, they will be sent to the surveillance center. For 14 days of being there, they will be again and again, be tested. But they will get their throat swab kind of test immediately, so to ensure that to ensure that they are negative, and they can remain in there for 14 days, isolation center. But more importantly as well is that as and when they arrive, they're not going to be, they go straight to the air disaster unit, which is quite a distance away from public, places like that. So it will be a dedicated place, and that will be, to give the assurance that there will not be, any form of interaction of this passengers group, 158 of them, with the public.
Could you tell me more about this surveillance center? Is it part of the hospital, or is it a different facility?
Well, the surveillance center is meant to take care of all those who are asymptomatic, meaning, they have got to observe, we have got to observe them, and for all that we, hope to provide to them, they will be observed. Because as we very well know, the incubation period is until now still, being researched. So a good 14 days they will be there, and our doctors and our care providers will be coming to, from time to time to take on testing, throat swabs and whatnot to observe. That will be not just isolation but as well observation. So it will be at a particular place that I'm not able to reveal for now, but it will eventually be disclosed, so that we don't want, But I've seen it today. I've seen it with the Deputy Prime Minister, with our National Disaster Agency group, and they are already well prepared, to accept this mission.
So I understand it's a quarantine, but are close family members allowed to visit them during the quarantine stage?
Not at all. No, there will be hardly any interaction of those for 14 days. That is total isolation.